puberty, that is normal puberty. Now, you could have this, when a lady gets to puberty, it takes few years, for example, for her to have a cycle, menstrual cycle regulated. It takes
Mm.
about 1 to 3 years, for example, before a
Okay.
cycle is regulated. Now, remember that one of the problems we see in PCOS, that is polycystic ovary syndrome, is actually menstrual irregularity. So you could
Okay.
think that, oh, am I dealing with the normal happenings that you see in the first few years of puberty? So one could actually miss that diagnosis there, or could it be the common menstrual irregularities that ladies do have? For this reason, someone could actually miss that diagnosis as well and say, oh, could it be PCOS? Could it not be PCOS? Remember also that it is not all women that have PCOS that are symptomatic. It is not
Yeah.
all of them that actually have complaints. So because all of them don't actually have complaints, you understand? So you may actually miss that one as well. But more importantly, there are actually early signs that you can actually say, oh, uh, when I see this, I might be thinking that, so could it be that this patient actually have PCOS? So
Okay.
what are those early signs, for example? If, for example, someone who has hitherto or previously been seeing a period regularly, suddenly a period becomes irregular,
Mm.
or for over a period of 3 months or more, she's not seeing a period. That is one. Secondly, she's now seeing herself as having hair growths on unusual places on her body. For example, on her face, her body, she's now having hair growth there. Hairs that were not there initially. And of course, this as a result of excess androgens, male hormones in her. That's why she's having this, unusual hair growth in some parts of her body, maybe on her body, on her face, and all of those things. Or in some situation, you see her that, oh, she's even having some areas of her body, what we
Mm-hmm.
call acanthosis nigricans, where she's having highly pigmented areas of her body, maybe under her armpits, on some elbow joints of her body. The areas are becoming, highly pigmented. That could
Okay.
give it a. And more importantly, also, she's having this unusual weight gain. Because those that have polycystic ovarian syndrome, they tend to have what's called insulin resistance, where the insulin is available, but the body is not using it up, and the body keeps producing more. And as the body is producing more, of course, you start having fat deposits, deposition of fat, and start, gaining weight. So for them that suddenly start having this unexplained weight gain, or they have even difficulty at even getting pregnant, and they are within the reproductive age bracket, you must begin to have that, index of suspicion that are we dealing with polycystic ovary syndrome.
All right. Thank you so much, Doc. Um, my next question is: are there other lesser known symptoms of PCOS that women may not immediately connect to the condition? Because typically, when you talk about PCOS, the first thing that comes to your mind are maybe irregular periods, amongst other things. But are there lesser known symptoms that women should pay attention to that they probably wouldn't have tagged with PCOS?
All right, thank you very much. Like I mentioned not quite long, I talked about the common uh, symptoms that could actually start making you think, could this be PCOS, maybe weight gain, irregular menstrual flow, and all of those things. But again, there are some lesser symptoms of features that you see in a woman as a clinician, as a gynecologist. You might start having this index of suspicion that, oh, let me ask further questions, let me examine further. So what are those complaints, for example? When you examine the woman, for example, starting from her hair, I begin to look at the hair on her head, the scalp head, and they are looking so sparse apart. They are looking so thin. You understand? Or you notice from your history, you're able to extract information from her, and she's been having this mood swing. Her mood is just swinging here and there, or she probably gets unnecessarily tired, or she's having issues as in disturbance. She complained of her not sleeping very well, or probably she's complaining of her, always wanting to eat, always wanting to eat, and all of those things. And that's the kind of weight she finds herself having now. She's not too comfortable with her, sudden weight gain, and she's been finding it very challenging. Very difficult for her to actually reduce her weight. In spite of all that she's been trying to do, she really can't go down and all of those things. But then you have, these complaints, or you're able to elicit some of those signs that I mentioned here, because these are lesser, really lesser signs of polycystic ovary syndrome, you might be thinking also that I'll be dealing with polycystic ovary syndrome. I think you're muted.
Oh dear. I don't know why I keep on muting myself. Okay. There are You had mentioned that weight and lifestyle are always mentioned in PCOS conversations. But how exactly does weight affect PCOS? Because you said, I think you debunked some myths at the beginning where you said just because a woman is overweight doesn't necessarily mean that she has PCOS. You also said that just because you know um that PCOS doesn't necessarily cause infertility, because there are women who have had have had or who currently have PCOS that can still have children, that have had children. But the question is trying to how exactly does weight affect PCOS, and why is weight loss so difficult for many women with the condition?
Okay. The question is that how polycystic ovary syndrome and weight, how they get to influence each
Mhm,
other, right?
mhm. Yes, basically,
Okay.
yes.
All right. Thank you very much. Now, we talk about one of the issues that you see here is insulin resistance. And, when there's insulin resistance, the body is not making use of the available insulin. And as a result of that, the organs of the body that is involved in the production of insulin, which is the pancreas, continue to produce more and more insulin. Now, for this reason, so insulin resistance make the body to store fats, because you have, a lot of this insulin. With the presence of insulin, the body tends to store more fats in the body. Now, as the body continues to store more fats in the body, that explains weight gain on one hand. That is one.
Mhm.
And secondly, because of this hormonal imbalance also, there tends to be increase in appetite, and the person tends to eat more. Okay. We've talked about two things now. The first thing is that there is, insulin resistance. The body is not making use of the available insulin. And as a result of that, the organs of the body, which is the pancreas, continues to produce more insulin. And as it produces more insulin, these are deposited as fats. And that explains weight gain on one hand. So on the other hand, again, because of the hormonal balance in the body, there's an increase in appetite. So when there's increase in appetite, there's increase in craving for food. All right. So by the time you have all of these things, again, you now discover that for those that have, PCOS, they tend to have weight gain because of what is happening as a result of the insulin resistance.
Okay, 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 okay. That's interesting to see and know. But what about mental health? We've seen a lot of women with PCOS experience. They say, oh, they're sad and depressed because, actually, when it is linked, actually, when the woman is married and she wants to start having children, she becomes depressed because she's like, this thing is what's not allowing me have children. How can women navigate their mental health when PCOS is involved, especially when we know that, I mean, is there a direct correlation or direct association with PCOS and mental health, and how can they handle it when it comes up?
Okay, thank you very much for me. Now, the polycystic ovary syndrome and mental health, yes, they seem to have something in common, because women with polycystic ovary syndrome, they seem to have higher rates. Evidence have shown that they have higher rates of anxiety, depression, low self-esteem, and of course, they seem to have this concern for their body image. Remember, we said about 40% of them
Okay.
are going to gain weight, and that is
Yeah.
going to be very disturbing. It's going to be very disturbing for them. And of course, we've talked about that not quite long on the reasons why it tends to have this weight gain in terms of insulin resistance. The body is not making use of the available insulin. More insulin are being produced, fat is being deposited, and because of this hormonal imbalance, they have increase in appetite, and of course, they tend to take more food and all of those things. So
Mhm.
because of this hormonal fluctuation, of course, that can explain why they can have this weight gain. So the impact of this, of symptoms that they have, for example, acne. When they have acne because of this, androgen and male hormone. So because of this androgen hormones, they seem to have this hyperpigmented area. And this hyperpigmented area, this acne, these dark areas gives them a lot of worry, a lot of concern, and even the weight gain also tends to give them a lot of worry, a lot of concern, and all of this can actually predispose them to having some mental health issues.
Issues. I want to backtrack a bit when you were debunking some of the myths or misconceptions of PCOS, where you talked about how PCOS is not really like doesn't cause infertility. Can you break it down for us? Because I mean, if you tell somebody that oh it's not PCOS that's causing their infertility, they might want to disagree with you that you're not the one that is going through what I'm going through. So can you break it down for us? Like how can PCOS stand on its own and not be? Because at the end of the day, irregular periods are one of the symptoms of PCOS. So you're saying that it doesn't cause infertility, and I'm not seeing my period. Then what exactly are you saying?
All right, thank you very much. Yes, this is not to say that, remember we said that depending on the climes and what your
Yeah.
reference is, some women that, in fact, if you look at PCOS generally, and if you look at some of the guidelines, see, these guidelines will tell you that about 75% of these women are going to have issues, trying to get pregnant. And even those
Mhm.
that actually get pregnant, about 50 to 60% of them are likely going to have pregnancy loss, what we refer to as miscarriage. All of this is explained because of polycystic ovary syndrome. Let us quickly break it down so that we can get the message and where we're coming from. Now,
Yeah.
remember we said that for those that have PCOS, for example, we are looking at their ovaries. Now, we are looking at the functional capability of their ovaries in terms of them whether they are able to ovulate, as is the release of mature eggs that will be made available for fertilization. That is not the case. It's not available. So there is an ovulation. That is one. Secondly, you want to look at the functional capability also of the ovary. Now, the ovary is actually involved in a lot of activities. And one of them is the production of steroids. Now, it's what's called ovarian steroidogenesis. That is production of hormones. Now, these hormones actually have a role to play in what's called the proliferation, the growth of the lining of the womb, the growth of the endometrium. The endometrium is the lining of the womb, so it plays a role in that place. Now, normally and at every month, you expect because the endometrial lining itself it has layers: the first, the second, and the deep layer, which we refer to as the basal layer. So usually, what happens is that the outermost layer, which is the superficial layer, is what is actually shed during every cycle. Now, for it to be shed or revealed as menstruation, the ovary must be doing its own bits in terms of producing these steroids that will go there and cause the proliferation of that endometrial layer. Just imagine a
Mm-hmm.
situation where the ovary is not doing that. So where the ovary is not doing that, that means there's no proliferation there. That is one. Secondly, that's what's it called now? The endometrial lining is not shed. And because of the endometrial layer is not shed, that's why the man is probably not menstruating. But the important thing is that the ovary that is supposed to produce mature follicles, mature egg that will be available for the sperm to fertilize is not
Mm-hmm.
available. So because it's not available, the woman will not get pregnant. So usually what we do as a gynecologist is that now when you have taken history from this woman, you have examined this woman. Like I told you, the treatment you give to patients that have polycystic ovary syndrome is an individualized treatment. All
Mm-hmm.
right. Because for some, like remember we said that for PCOS, some of them they are asymptomatic. There's really no complaint. You understand?
Mm-hmm.
But for some of them, they might just come because of weight gain. But for some of them, they might come because of irregular menstrual flow. Do you understand what I'm saying? For some of
Yeah.
them, they might come because they cannot get pregnant. So once we are able to establish that, oh, this is the reason, based on the what we know about the pathophysiology of polycystic ovary syndrome, oh, this man can actually not get pregnant because one, there's something to suggest that she's ovulating, and more so she's not menstruating. So what we want to do, of course, will now be what we want to regulate the period for her so that she starts
Mm-hmm.
menstruating. And of course, once she's menstruating, the ovary is responding, and of course, we give her that drug also so as to induce ovulation for her.
Okay. Okay. I got it. I got it. I got it. I'm hoping that somebody who's listening to is getting it. What's the role of nutrition in managing PCOS? I have seen personally people say that they had to get their diet right to be able to manage PCOS. But from a medical point of view, from medical standpoint, what is your take on the role of nutrition in managing PCOS? And have you seen success stories of women who took, it seriously, and it's corrected or it managed the PCOS for them?
Okay, thank you very much for me. Again, I think I will respond like this also for us to lay this template so that when we lay this template, we know exactly where we're coming from. So that when I'm start giving responses, we know exactly what the response is, what message the response is trying to put across.
Okay.
Firstly, PCOS, polycystic ovary syndrome, some people who have it, they don't need treatment because it's
Okay.
asymptomatic. Let's get that. They don't need treatment. All right. So that's the first thing because they're actually symptomatic. So just that, maybe it was based on our investigation and all that, that we're able to establish that, oh, this person has polycystic ovary. Now, ovary syndrome, sorry. Now, nutrition actually has a very important role too to play in the management of polycystic ovary syndrome. Particularly, we talk about the insulin, for example, that there can be insulin, resistance, the insulin level and all of those things. I know insulin and food, you know what it does so that insulin can continue to break it down and all of those things. Now, it's been shown that there have been some, helpful, useful intervention in the past with the use of diets, particularly those that have been shown to be taking, diet that is rich in vegetables, diet that is rich in, healthy fats, and more importantly, also for those that actually take food that is actually, with limited, carbohydrates. You understand, with limited carbohydrates because of the, effect of, insulin with limited carbohydrates. It's shown that, they tends to do, very well with this type of diet when the diet is actually less in carbohydrates, they have
Okay.
vegetables, it's been shown to do very well with them. But there are some other food also that we know also that for those that have polycystic ovary, I'm sure even the nutritionist also will talk well on that, that they will want to probably tell them that they should probably stay away from it. For
Mm-hmm.
example, all the drinks, sweetened drinks, high sugar food, for example, the refined carbohydrates, all of those food that has to do with, carbohydrates, glucose and all that, they will tell them to try as much as possible to either stay away from them or reduce it. Okay, so because they can actually make the condition worse as well. Remember, we said that because and why this is understandable, but understandable in the sense that we said that it's insulin resistant, meaning that
Mm-hmm.
insulin is there, but the body is not making use of insulin, and they have a risk of developing type 2 diabetes mellitus, and they are still pumping the body also with carbohydrates that the insulin will eventually not break down. So I'm sure your guess is as good as mine why it is important for them not to be on the diet like that.
Mm. Okay. Now, PCOS has different presentations in different women. How important is it for how important is individualized treatment, and what factors do you consider when tailoring treatment for a patient?
Yes, thank you. I hope I'm audible.
You are, yes.
Okay. Yes, so the factors that you are going to consider here is that, like we said earlier, you have to individualize the treatment for the patient. And when you are individualizing the patient, hello?
I can hear you. Hello, Dr. Iwanova. Can you hear me?
So can I change? No, let me try to see whether I can move to another network. This
Okay.
network is,
Okay.
sorry, just a minute.
That's fine.
Hello, can you hear me?
I can hear you. Yes, I can.
Hello?
I can hear you. Yes. Can you hear me?
Hello? Okay,
I can hear you.
all right, thank you. I can hear you now. Yeah, I can hear you.
Okay.
Yeah,
All right.
so we're looking at the individualized treatment for
Treatment.
these
Yes.
women. And
Yes.
remember, we said that PCOS actually affects women differently. So
Mm-hmm.
that is why it's important for us to individualized treatment. For example, some women could actually present with, the menstrual cycle, and that they are having this short menstrual flow, or they are not seeing their period. Once they are not seeing their period, so that means it basically has to do with their problem of irregular cycles or even fertility issues. So when they have
Mhm.
this irregular cycle, of course, they will be considered for treatment at this point. And for those also that have fertility issues, of course, no, it will be strictly for that, and that will be what we look at. But again, some of them, it might just be that the reason why they presented at the hospital basically has to do with the weight gain, the unexplained weight gain. So treatment again will be tailored towards lifestyle modification with respect to reduction in their weight, because that appears to be the complaint that they've actually presented with. So usually the treatment that we give to them will include lifestyle modification. For some of them, we might have to give them some hormonal treatment as well. We have to give that to them. And for some of them, it might just be that we need to support them emotionally, because really, we talk about the mental health as one of the problems that could come up as a result of polycystic ovary syndrome. So it might just be that we need to support them emotionally as well. So these are some of the individualized treatment I will give to them. So it depends basically on what the complaint is, and that will form the basis of whatever treatment I will be offering to the patients. So you are muted. Okay, okay, I can't hear you. I think it's cracking.
I was muted. I said in this country, in a country like ours where we self-diagnose any little thing. Oh, my head is paining me. Oh, I think I have a headache. Oh, let me give myself one of the painkillers. Oh, my stomach is paining me. We're always self-diagnosing. How dangerous is it for someone with PCOS to self-diagnose? Like, when should that person see a specialist?
All right, thank you very much. Can you hear me?
I can, yes.
Okay, yes, yes. Like you rightly mentioned, there are a lot of risk involved when someone make self-diagnosis, and of course, it's important for one to see a specialist, because self-diagnosis can actually be very, very harmful.
Yeah.
Harmful in the sense that harmful in the sense that, for example, normal could have one could just what one is experiencing could be very normal, could be a normal occurrence, or a normal events in our body, and that could be taken to mean a polycystic ovary syndrome. And of course,
Mm,
until one gets to see a specialist before you can know. There are some conditions, for example, like thyroid disease. You can have cases of hypolactin, or even hypolactin. Of course, once you have this could, it could take the other a wrong diagnosis and say, oh, this is what's wrong with me. And in a real sense, that is not what is wrong with you. So really, women may actually make use of inappropriate treatments that they found online because of wrong diagnosis. And before you know, they are on a treatment that they ought not to be. So the way to go about this really is that a woman should actually seek specialist review. And when do they normally get to see their specialist? When is the right time for say, oh, I need to go and see my gynecologist. I need to go and discuss one or two things with my gynecologist. For example, when their periods are consistently becoming longer than it used to be, maybe more than
mm,
35 days, for example. Okay, between the first and the other one is getting more than 35 days, so they need to see their gynecologist.
gynecologist.
Or for them, hello.
I can hear you.
Okay, or for them, they notice that, so they are having this what they used to they suddenly notice that they have unusual hair pattern on their body, maybe on their body, on their face, and it's becoming worsening for them. So they have to see their gynecologist, or suddenly they notice that their weight gain seems to be on the increase and is not coming down. Of course, they need to see their gynecologist. And of course, more importantly, also, they notice that they've been married for some time and they've been struggling to conceive, and it's been very difficult for them to conceive.
Mm-hmm.
Obviously, they have to see their gynecologist. And in some cases, it might be that so they have some abnormal blood tests that they have done, and those tests is saying that so there's some of abnormality. They need to take that straight to their doctors so that their doctors can actually look at them early, and then when necessary intervention is needed, they will be offered.
Okay. Okay. What about long-term health risks that are associated with unmanaged PCOS? Because just like we have women who
So
have
let me
gone to the
change this network. Just a minute. Let me change this network. Sorry, just a minute.
okay.
Hello.
Hey, yeah, I was about to, are you back, sir?
Yeah, I'm back. Sorry, I'm back now. Can you hear me?
I can hear you, yes. I think the networks today have been very, very up and down today from the beginning of my show.
Yeah.
Okay, I was asking
Okay.
about what happens to women who have left their PCOS undiagnosed and unmanaged. What are the long-term health risks that are associated with it? Uh, Are there diseases that are associated with it? Like, how can women protect themselves? Uh-oh. We seem to have lost Dr. Ewanama.
That network has been so friendly.
Yes, it has been today. Today has been really bad. Hi, Dr. Ewanama. Can you hear me?
Wow. I can't hear you. Sorry, the network is really bad.
Mm-hmm. Can you hear me now?
Yeah, I can barely hear you now, but I can still hear you. Maybe you should just speak up a bit.
Okay, I was asking that what are the long-term health risks that are associated with unmanaged PCOS? How can women protect themselves?
Yeah, there are lots of long-term health complications that could occur to women that have PCOS, and that is why it's important for a woman to present early, especially when they have unusual complaints, or they notice unusual events or happenings on their body, because PCOS itself. For example, for a woman that has PCOS, over time, if that condition is not properly managed, end up to develop diabetes mellitus as a long-term complication. That is one. Secondly, a woman also with PCOS, if she didn't present early, she's not seen, she's not evaluated and investigated and treated, of course, she could end up not having, pregnancy or not having babies. And again, for women that have not been ovulating for a while, that part of the womb that has not been shed as a menstruation will undergo what we call endometrial hyperplasia, where that place becomes very thick. And if you
Mhm.
have that kind of thick and what we call maybe endometrial hyperplasia with atypia, for example, the risk of that woman developing endometrial cancer or cancer of the womb is actually very high over time, also because of that. And also because of this, if a woman is not seen on time or she has left the PCOS unattended to, not treated by the doctor, she will have other complications also, like hypertension, problem with her cholesterol, heart-related problem like cardiovascular events and all of those things. So all of these are possible complications that could come up as a result of when the polycystic ovary syndrome is actually not attended to or
Mhm.
not treated.
All right. Thank you so much, Dr. Ewanoa. With that, we've come to the end of our today's edition of Radio Doctor. Despite the bad network, we scaled through on today's free consultation on Radio Doctor. Today we've been talking about polycystic ovary syndrome with Dr. Ewanoa. Dr. Ewanoa Timdire is a senior registrar in obstetrics and gynecology at Lagos Island Maternity Hospital. He's also the vice chairman, beg your pardon, of the Nigeria Medical Association in Lagos State. Thank you so much, Dr. Ewanoa, for coming on the show today.
Thank you very much for having me, Fumi. Thank you so much. It's my pleasure.
Yes, yes. Radio Doctor on Women Radio is Nigeria's first free consultation specialized radio health program, broadcast Mondays through Fridays, 10 a.m. Do join us tomorrow at 10 a.m. for another edition of Radio Doctor. We still have amazing shows for you on Women Radio. Do stay with us. Do not go anywhere. My name is Fumi Bangala, and this is Women Radio.